Hello everyone, this is Dr. Nischal R Pandya, consultant pediatric and adult cardiovascular thoracic surgeon at Fortis Hospitals, Bangalore. On the occasion of World Heart Day, I'd like to talk to you about something that is very dear to my heart, and that is congenital heart disease. Congenital heart disease is a spectrum of disease that is present from birth. It starts developmentally and may be picked up much earlier before birth, may be picked up at birth, or may be picked up years after birth. So what does this disease entity involve? It has either pink babies, that is acyanotic congenital heart disease, or they may be cyanotic congenital heart disease, or the blue babies. These kids usually present secondary to a murmur that the clinician hears. They may present because they have come with repeated respiratory tract infections, especially the pink ones. They may come because they have fast breathing, they cannot take in the feeds properly, they get easily fatigued. The blue babies have a typical history of bluish discoloration around the lips, the nail beds, or they are very dusky overall. Sometimes the worst variety have syncopal episodes or loss of consciousness, what we call death spells. So it is very important that these kids are all picked up early, one thing. These are picked up by clinical examination, where your clinician, your treating doctor may hear a murmur, but there may be other signs, and you're sent to a specialist. The specialist, the cardiologist, the pediatric cardiologist would then do an echo, an ECG, to see what your heart looks like. The echo is basically a scan of the heart, and that will tell us what the problem is in the heart in the form of structure and also function to a large extent. It is important that these problems are picked up and treated in a timely fashion, otherwise they can lead to severe form of the disease as it progresses. The burden of congenital heart disease is huge worldwide. In our country, it is to the tune of 1.8 to 2 lakh children being born with congenital heart disease every year, with an infant mortality rate of up to 10%. That is huge. This causes huge amount of emotional, social trauma. It's a large burden financially for the parents as well. Socially, it's a burden as well on the society when our upcoming generation is afflicted with heart disease. These diseases can, to a large extent, be picked up somewhere between the 18 to 20 weeks of pregnancy, and that is where we do a fetal echo. It is a specialized echo done in few centers where the heart is looked at carefully when the child is in the mother's womb, around 4.5 to 5 months of pregnancy. A healthy heart is a happy heart, and healthy children are a nation's future. So it is very imperative that we pick up these diseases in our little growing kids and give them the right treatment at the right time to help them grow better. Telehealth has gone a long way in bringing us clinicians to patients that are far off, that are not in reach, that are sometimes not in touch because of various problems in these COVID times especially. So again, I urge you all to mask up, stay safe, practice good hand hygiene, and yes, please see your doctor regularly, if not directly, at least consult. If there's any problem of a cough, cold, illness in you or your child, make sure to reach out to them and seek help at the earliest. Stay safe, stay healthy, and thank you.
Subscribe to Midday India. Get direct notifications on all our videos by clicking on the bell icon.